I was the director of a family and community support service for 16 years. Occasionally, I was asked to sit down with frequent users of the food bank to see if there was any additional funding they could access or places they could cut back on spending. It was a simple request, and early on in my career, I thought that the answers would be simple. Stop drinking and smoking, get rid of your large pets, get a better job, and start making better financial decisions. I learned very quickly financial strain is a complex issue. We seldom found an easy solution to any of their difficulties. I realized that smoking and drinking were often coping mechanisms for trauma experienced in their life. Pets often took the place of human contact and nurturing, providing the unconditional love that people were missing. Some people just didn't have all the good health or skills and abilities necessary to get a higher paying job, or any job at all, even if opportunities were there. I remember most people saying to me in those conversations, "How do I budget better when I have no money to start with?" Our visit would usually end with me phoning the food bank and giving the go-ahead for them to have another food hamper. I often wondered, if there was no helpful help I could provide, why even have these uncomfortable conversations? Years later, in my new position as an AHS Community Health Promotion Facilitator, I received a phone call one morning from my manager about a pilot project called Reducing the Impact of Financial Strain. I was excited to get involved. The project goal of having healthcare providers screening patients for financial strain just made sense to me. I knew it would have great impact if we could pull it off. One of the first projects we did as a team was a poverty simulation in order to build understanding of what it was like to live with financial strain. I was a single parent of 2 children with a grandparent in the household. Each family was given a unique package that provided them with weekly tasks, a month's worth of money, bills to be paid, and items to be pawned if needed. The goal was to get through the month without running out of money. It seemed like there was just not enough time to get everything done. As a father, I felt guilty that my children didn't take part in after-school activities because they had to work or babysit. I forgot to purchase enough transportation coupons for all our family activities. We spent so much time just trying to access what we needed to get by that there was no time to improve our situation. I don't think any of us expected it to be such a powerful experience. After years of having these conversations with others, I had a much deeper understanding of their daily reality. Many of us commented about how it was so exhausting to live with financial strain, and we only did it for an afternoon. Together we realized how difficult it was to think about healthy living when all we could focus on was getting through the next week. And the conversation shifted to how the best healthcare in the world would not help us when we were living in financial strain. As communities, we can ask the questions, listen to the stories, understand each other, and learn to provide helpful help that supports us all to live healthier lives.